Hi, my name is Jeannie Nguyen, and today my Teach-1 assignment is on precision and predictive medicine for HAP 360. Our purpose today is to analyze the effectiveness of different antidepressants on patients based on the given data. Let's first go over what precision and predictive medicine is. So precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle of an individual, and also allows doctors to choose a treatment that will be most effective based on the genetic understanding of the disease. Predictive medicine is the probability of the disease and taking steps to prevent or decrease its impact on the patient. Our first objective is to create a table showing the relationship between anxiety diagnosis and the response to citalopram. To make the table, we have to download the given data. Once you've downloaded it, this is what you'll get. To make the table, you go to Insert and create the pivot table. You should have all the data selected and click OK. To create the table, we first have to find generalized anxiety diagnosis and put it into rows. Then we're going to find CIT success and put that into columns and into values. In the values, we want to click on it and change the value field setting to count. To find the success rate, we're going to take the success of the medication on the patients who have been diagnosed, which is 117. So it will be equals, click on the cell, divide by the total number of success, and press enter. So the success rate for CIT is 0.319 or 32%. Our second objective is to find the highest success rate for the rest of the medications. So going back to our data, you want to click on the table and you want to remove the fields in the columns and in the values. And we'll add BUP success to both columns and to values. And you also want to change the sum to count. And to find the success rate, you want to divide the success of the medication and to the patients who were diagnosed with the total number of the success. So the success rate for BUP is 0.206 or 21%. And you're going to want to do this with the rest of the medications. So for SER, the success rate is 27%, BEN is 13%, CT is 20%, MIRT is 13%, and NTP is 0%. When put all into a table, the medication with the highest success rate is CIT. So why is it difficult to understand which medication works best for patients with general anxiety depression? It's difficult because not everyone's the same. Everyone has different beliefs or stress, and medicine also is not the same. They have different strengths and side effects that can affect someone more than the other. And the medicine can have either a positive or negative impact for one patient while the other, nothing happens. Our third objective is to find which medication has the highest success rate when the patient has a substance abuse. So essentially, you're doing the same thing as we did for the first objective, but instead of using generalized anxiety, we're going to use drug abuse diagnosis and put that into rows. We're first going to do the CIT success. And we're going to change the sum to count. And for the success rate, you want to take the success of the medication and the patient's who were diagnosed and divide it by the total. So you'll get 0.31% or 31%. So for the rest of the medication, BUP is 38%, VEN is 14%, FER is 22%, CT is 0%, and CT is 14%, and MIRT is also 0%. Putting them all into a table, you can see that DBT has the highest success rate for patients who has drug abuse diagnosis. I'm also going to show you how to do the first optional assignment. And it says, given that the patients who have anxiety depression also tends to have abuse substances. So we're going to identify the best medicine for anxiety depression after removing the confounding effects of substance abuse. We are going to use the two tables that we have made for both the general anxiety patients and the drug abuse patients that has all these success rates on them. And you can see that CIT is the best medication since it has the highest success rate for patients diagnosed with anxiety and the second highest for patients who suffer from drug abuse. This is the end of my presentation. Thank you for watching, and if you guys have any questions, please feel free to email me.